All right, everyone, this is part 2 of the cluster B personality disorders. Today we're going to be talking about borderline personality disorder. This is one that is close to my heart because I experienced borderline personality disorder. I've never been officially diagnosed, however, being that I am trained in diagnosis, being trained secondarily in my master's program right now. I did get trained during undergrad in diagnosis as well. I'm pretty confident in my diagnostic abilities, and I've studied personality disorders most of my time in college. I've written several college papers on personality disorders, attachment disorders, stuff like that. So I generally know what I'm talking about when it comes to personality disorders. So the criteria for borderline personality disorder can be found on page 752 of the DSM-5-TR, which is what we're looking at today. Part A, actually there is only one part to the diagnostic criteria in borderline personality disorder. And that is a pervasive pattern of instability or interpersonal relationships, self-image and affects, and marked impulsivity beginning by early adulthood and present in a variety of contexts as indicated by 5 or more of the following. So you have to have at least meet 5 of these criteria in order to be considered as having borderline personality disorder. There's 9 here. So the first one is frantic efforts to avoid real or imagined abandonment. 2, a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. 3 is identity disturbance, markedly and persistently unstable self-image or sense of self. 4 is impulsivity in at least 2 areas that are proportionately self-damaging, i.e. spending, sex, substance abuse, reckless driving, binge eating. 5 is recurrent suicidal behavior, gestures, or threats of self-mutilating behavior. 6, affective instability due to a marked reactivity of mood. This is intense episodic dysphoria, irritability, or anxiety, usually lasting a few hours and only rarely more than a few days. Number 7 is chronic feelings of emptiness. 8 is inappropriate, intense anger or difficulty controlling anger. And then 9 is transient, stress-related paranoid ideation or severe dissociative symptoms. Now, when we think of borderline personality disorder, that's generally what people mean when they think of bipolar disorder. They get their wires crossed with those two. Bipolar disorder is more commonly recognized and understood. The difference between bipolar disorder and borderline personality disorder is with borderline personality disorder, the mood shifts can be minute to minute, hour to hour, day to day. Whereas with bipolar disorder, you have intense highs and intense lows. And these can go for, say, you have an intense high where you're happy-go-lucky, carefree, you feel invincible. This will last a few days, a few weeks even. And then you have that crash, the extreme lows, the depression, and that can last a few days or a few weeks. Generally speaking, it usually lasts about a week to 2 weeks per mood swing. However, with borderline personality disorder, it can change minute to minute. You can be really angry 1 minute and then kind of carefree the next. So when people, generally speaking, when the general public says bipolar, what they actually mean is borderline personality disorder. And oftentimes in men specifically get misdiagnosed with bipolar disorder when actually they have borderline personality disorder. It's because of society's feelings toward men showing emotion. Relating to that, under sex and gender related diagnostic issues, it says here, While borderline personality disorder is more common among women than men in clinical samples, community samples demonstrate no difference in prevalence between men and women. This discrepancy may reflect a higher degree of help seeking among women, leading them to clinical settings. Clinical characteristics of men and women with borderline personality disorder appear to be similar, with potentially a higher degree of externalizing behaviors in boys and men and internalizing behaviors in girls and women. An individual with borderline personality disorder, if they have a comorbid personality disorder, meaning they have more than one personality disorder alongside borderline personality disorder. With men, it's generally either narcissistic personality disorder or antisocial personality disorder. With women, it's generally narcissistic personality disorder or histrionic personality disorder. Differential diagnoses is depressive and bipolar disorders, separation anxiety disorder in adults, and other personality disorders, as well as personality change due to another medical condition, substance use disorders, and identity problems. Now, one thing about personality disorders, and I've discussed this with classmates, I've discussed this with faculty, with my professors, and everyone agrees that there's merit to this. And that's the idea that personality disorders generally stem from undiagnosed autism. That isn't to say that everyone with a personality disorder is undiagnosed autistic, but generally speaking, a lot of times personality disorder will develop because of trauma sustained in childhood due to undiagnosed autism. Risk and prognostic factors. Environmental, that's the nature or the nurture part of nature versus nurture. Borderline personality disorder has also been found to be associated with high rates of various forms of reported childhood abuse and emotional neglect. However, reported rates of sexual abuse are higher in inpatients than in outpatients with this disorder, suggesting that a history of sexual abuse is as much a risk factor for severity of borderline psychopathology as it is for the disorder itself. In addition, an empirically based consensus has arisen that suggests that a childhood history of reported sexual abuse is neither necessary nor sufficient for the development of borderline personality disorder. So what they're saying there is that, generally speaking, if a child is sexually abused during childhood adolescence, then their risk of developing borderline personality disorder is much higher. However, not everyone with borderline personality disorder was sexually abused in childhood or adolescence. The genetic and physiological factors, nature, out of nature versus nurture. Borderline personality disorder is about 5 times more common among first-degree biological relatives of those with the disorder than in general population. There is also an increased familial risk of substance use disorders, anxiety disorders, antisocial personality disorder, and depressive or bipolar disorders. Common co-occurring disorders include, but are not limited to, depressive and bipolar disorders, substance use disorders, anxiety disorders, particularly panic disorder and social anxiety disorder, eating disorders, post-traumatic stress disorder, and attention deficit hyperactivity disorder. Borderline personality disorder also frequently co-occurs with the other personality disorders. So let's look at that attention deficit hyperactivity disorder. This is what you can call a neurodivergent disorder, or what I like to refer as a neurodivergent variant, because I don't really consider neurodivergence as disorders. They are variants because of the brain chemistry. It's how we were born. I myself am autistic. About 80% of autistics are diagnosed as also having ADHD as well. So when you think about that, being that ADHD is a very likely comorbidity with borderline personality disorder, meaning they co-occur in the same person, and with 80% of autistics having ADHD, about 60% of people with ADHD have autism. So think about that. That means that there is a strong connection between neurodivergence of autism, ADHD, and borderline personality disorder. So next time, we are going to look at histrionic personality disorder, followed by narcissistic personality disorder. So I hope you guys tune in then.